For most hospital projects, hiring an architect is the primemost thought that comes to a promoter's mind. All well, but how does an architect understand a hospital project? It is important to understand the type of services that the hospital is planning to offer, the size of the hospital in terms of the number of beds, what kind of OPDs that need to be designed, how many operation theaters, how many ICU beds, what does the EMS have to have. Therefore, it is important that right at the outset, the promoter engages with a hospital consultant who understands these aspects and facets of a hospital development. He understands how do you define the OPD numbers, how many OPD conversions do you have for an IPD, and how many operation theaters are required to service the facilities and the disciplines that the hospital is planning to offer. The role of a hospital consultant can therefore never be overemphasized. He understands the demography of the area, he understands the paying capacity of the patients that the hospital is trying to service, and therefore he is able to guide the architectural planning right from the medical planning perspective. The type of services, the flow patterns and processes, the staffing patterns, what is it that the operators require, the service providers require. This is something that a hospital consultant understands thoroughly, and therefore engaging with a hospital consultant at the outset is of paramount importance. It is important to understand the number of beds that the hospital requires. Today, most hospital promoters emphasize on beds. They feel that the larger the number of beds, the better the revenue. The world is moving in a different direction today. We are looking more at daycare procedures, and therefore we want the hospital turnaround of patients to be faster than used to happen in the earlier days. The number of beds does not necessarily define the potential of a hospital. It is important, therefore, to understand the impact of these facilities that the competition is providing. This is something that a hospital management consultant or a hospital planning consultant understands thoroughly and is able to define the type of size that the hospital should have. We also need to understand the future that the hospital is going to lead into. What is it that the future holds for this hospital, both in terms of services, in terms of expansion of beds, and adding more facilities and disciplines that the hospital may need to service at a later date. Understanding the incidence and prevalence rates of the disease patterns that the hospital is planning to service and the growth of these with the growth of the population is something which is very important to understand, and this again would define the number of beds that the hospital needs to have. Thus, while a hospital planning architect understands the nuances of a hospital, the medical planning inputs are provided by the hospital consultant. This is a teamwork, and promoters of hospitals need to understand and appreciate this factor, and they need to get this entire team on board before launching on a hospital project.